Good evening, everyone. My name is Bill Hekla, and as chair of the South Bruce Grey Health Center's Board of Directors, I'd like to extend a warm welcome to our Zoom participants and Facebook Live viewers as we begin this evening's virtual community information session. I'm joined this evening by a panel of South Bruce Grey Health Center board members, staff, physicians, as well as representatives from the Building Healthcare for Generations Capital fundraising campaign and Huron Bruce MPP Lisa Thompson. Together, the group will provide an overview of all of the exciting capital projects underway at the Kincardine Hospital and the status of these projects. With that, I will welcome President and CEO Michael Barrett to begin this evening's presentation.
Thanks very much, Bill, and welcome to everyone. We've got some exciting news to share tonight about all the corporate projects that are going on, the capital projects, I should say, in the Kincardine Hospital. So lots of good things are happening in Kincardine, and the purpose of this event tonight is to share that information with the public so that you're aware and give you an opportunity to ask us any questions. Bill did a quick go through of the people that you'll be hearing from tonight. So we've got a whole mix of we have staff members from the hospital. We have Dr. Sung, who's the site chief for the Kincardine Hospital. Also have representatives from the Kincardine Community Healthcare Foundation. So we've got lots of information to share. You're going to hear from a number of different people. And if at any point in time you've got a question, please put it into the chat box. Or put up your hand, and all of you will be on mute right now. But if you want to speak, put your hand up and we'll recognize you, and then we can release the mute. And we do that to make sure that we don't have background noise for the presentation. So just to start off, there's some logistics that we need to take care of. So for those of you that are joining us on Zoom, hopefully most of you have had a Zoom call over the last 2.5 years. It's become quite popular during COVID. If you haven't, though, along the bottom is a menu bar. And so if you want to connect your video and show your face for the call, press that stop video button or start video button if it's got a red line through it. And that way we can see your face. But obviously, it's up to you to decide whether you want to be on video or not. If you do want to ask a question, as I said, please press under reactions. Under reactions, you go to a next button. It says raise hand. And if you raise your hand, we'll see that hand and we know that you want to say something, and we'll recognize you and give you the opportunity to ask the question or make a comment. The other option, as I said earlier, is to use your the chat box. And the chat box is actually a button along the menu bar as well. Just if you hit that chat box button, then you can type in your message. It can be a question, a comment, and we'll make sure that we get that recognized. And the other component to the logistics tonight is that we're, in addition to the Zoom call, we also have this streaming live on Facebook Live. So if you're joining us by Facebook Live and you do have a question, please answer your questions. And we're going to take those questions. Madison's going to do this. I think it's Madison or Madison's going to transfer that question over to the chat box in Zoom, so your questions will be recognized. And if at any point in time you have any questions about the logistics or the technical parts of the call, please let us know. We also have the opportunity for people to join in by phone. So if you are joined by phone, there's a couple of commands that you should know. The first one is *9. This will allow us to know that you're raising your hand and you want to have a question or a comment. So press *9 if you want to make that comment or have a question. And then to mute and unmute your phone, please press *6. So either *9 to raise your hand or *6 to mute or unmute. And as I said earlier, this is being broadcast and recorded on Facebook Live. And the recording of this session will be available on our Facebook page after the session. So we've got a number of updates tonight, and we're going to start with the CT scanner project. We'll provide an overview of what's going on with the CT scanner. You're going to hear a bit from me, and then I'm going to pass it over to Stephanie Douglas. You're also going to hear about the expansion of the Kincardine Hospital. There's lots of great work going on around the expansion of the Kincardine Hospital. And then we've got MPP Lisa Thompson for Huron Bruce to make a special announcement as part of this presentation tonight. And then finally, as both Bill and I have said, there'll be a presentation from the Kincardine Community Healthcare Foundation with President Becky Fair and Vice President Jack Nanskaville. So this picture here is back in April of last spring. This is the sod turning ceremony for the CT scanner. This portion of the front yard looks a bit different now with the CT scanner building almost complete on the outside. But this is a really special day. We had a representation from the municipality with Councillor Doug Kennedy. We had Jack Nanskaville, Carol Collins, and Graham Mahood from the Kincardine Community Healthcare Foundation. Dr. Jason Murray, many of you will know Dr. Jason Murray, family physician, emergency department physician here in Kincardine. And then we also had one of our board members, Doug Harris. And then we also had a representative on the second from the right, Chris Mudrick, who's an executive vice president with Bruce Power. Bruce Power has been very generous with us for the financial support for the CT scanner. And then myself, Drew Braithwaite, and Steph Douglas are in the picture as well. So back in April, when we had this sod turning ceremony, we were very fortunate to have a visit from Lisa Thompson, our member of provincial parliament for Huron Bruce, where she approved the construction of a 2,000 square foot addition for the addition to house the new CT scanner. So this CT scanner is getting very close to completion now. It's going to be operational in March of next year. You're going to hear a bit more about that from Stephanie Douglas, our corporate planner. And just want to thank, first of all, Lisa and the government of Ontario for their support to approve this and financial support. And we also received financial support for the CT scanner from Bruce Power and again from the Kincardine Community Healthcare Foundation. And just this last slide before I pass it over to Steph Douglas, it's really important to note that right now we need a CT scanner in Kincardine. We have many days, it could be 4, 5, 6 patients that we're transferring out of Kincardine to get a CT. Typically, they're heading to Walkerton to get that CT. And many times the patient is accompanied by a nurse or a physician. And what that means is the nurse is having to leave the Kincardine hospital to accompany that patient to the Walkerton site. This will ensure that patients can stay in Kincardine, saving stress and time for the patient and their families. So with that, I'm going to pass it over to Stephanie Douglas, and Steph's going to walk us through some of the steps we've taken to get to this point of getting the CT scanner approved.
Thanks, Mike. As Mike mentioned, I'm the corporate planner at the hospital. I oversee the planning and design of some of our large capital projects. So in order to get to the announcement that Lisa made in April, the start of construction, we had to go through four different stages and approvals by the ministry that included our planning and design for the CT addition. So that took us through the proposal, the functional program, the preliminary design, and the construction tender. And then now we're in stage 5, which is the construction. So here, if you've been to the Kincardine site in a while, you will see all the commotion out the east of the building. So we started in May 2022 with the excavation of the foundation, followed by the construction of the steel studs and closing the building. Let's go to the next slide. And then on to the interior finishes. So the lead lining for the CT suite, and then the interior finishes. And now we're into the interior fit up, getting all the fixtures installed and connecting the services from the existing building to the new addition. So the Siemens X.Cite CT scanner is the reason that we're building this addition. So the CT X.Cite features a better, efficient workflow, artificial intelligence that automatically position the scanner to improve imaging quality and reduce the radiation dose. And it has a larger bore that increases patient type and sizes that can be scanned. So we will be completing construction in February 2023. And we expect the arrival of our CT scanner the end of February. So construction has to be completely done. The site has to be cleaned, and we turn it over to Siemens, who's the manufacturer of the CT scanner, and they start their installation and commissioning. And then we also have an extensive training program for staff, and we will start to see patients end of March 20th, 2023. So I'll pass it over to Drew, who will go over the hospital expansion and redevelopment.
Thanks, Stephanie. I'm Drew Braithwaite. I am the Chief Financial Officer and the Vice President of Corporate Services here at South Bruce Gray Health Center. Part of my role is also overseeing the expansion and the redevelopment of the Kincardine site. Similar to the CT scanner, there's 5 stages to the redevelopment. Currently, we are in the preliminary stage, stage 3. We've done the submission for that, and we're moving forward with the redevelopment. The proposed redevelopment is a 34,000 square foot expansion and modernization of the emergency department, the diagnostic imaging department, the laboratory, the decontamination room, emerge, the lobby, and the back of house. So in this drawing, you can see the existing hospital. There's a black, thick black line on the bottom part of the drawing that indicates the existing building. The pink is the existing emerge department and comes around into the front entrance and into the front lobby. The green is the expansion area, which will be DI, and the blue is the front of house, as well as the yellow there. It shows the loading dock expansion, and then a small expansion to the south for the emergency department. So this shows what we've added on in the proposal. The current emerge space is around 4,000 square feet. We propose to move that up to 12,000 square feet. The medical imaging department, where it currently is located, that'll be taken up by the new emergency department, and the medical imaging department will move out to the east into a new 7,000 square foot addition, which includes the current CT scanner building that we've incorporated into our design. The front of house area will be expanded from our current registration. When the patients enter the hospital, they'll come into a nice large waiting room and vestibule that'll include the foundation office, waiting area for registration desks, and the gift shop. As well, we'll do modernization of the dock, the loading dock, food services, and then of course we need the circulation space to get around to all of these areas. So some of the key considerations that we had to do when we started on the expansion project, a lot of the rooms have set targets from the Ministry of Health with benchmarks on the size of those rooms. And the expansion is based on the general population growth and the demographic shifts in the area from the Ministry of Finance data that we get. And we also factored into the population growth impacts of the Bruce Power construction related to the major component refurbishment that's happening over the next few years. So in this as well, it's not just the building that we have to consider for redevelopment. We have to redevelop the site as well. So this drawing, I apologize, it is a little bit small, but you can see the existing hill where we will come up. We will actually create a separate emerge entrance and a separate entrance for the ambulance and police. And there will be parking for emerge just south of the building there. And all other patients will enter through the front of house, what is now just an expanded from our main entrance. So the front of house and the lobby and the gift shop and registration is where the majority of the patients will enter, other than those emerge patients. So you can see here, we've got the gift shop, the laboratory, and the outpatient lab is located right there at the front. The foundation office is also located at the front of the building, and close to DI for the outpatient and inpatient services there as well. So some key highlights that we wanted to make sure that we had that front of house when we designed it. We wanted to make sure that it was visible, that we improved the wayfinding. There was greater visibility for the foundation office as well, and also to really create a warm and welcoming space so that people are easily able to navigate to the areas that they want to go to within the hospital. So the next phase here, I'll pass over to Dr. Sung.
Thanks, Drew. It's Dan Sung here. Hi, everyone. I'm a site chief for Kincardine and a family and emergency physician. Mike Barrett tells me that we haven't really had any significant structural changes to the hospital since 1986. And I really feel that this is a time where we have the opportunity to mold our hospital to serve the generations to come. As many of you know, I do a lot of emerge work, and it's sort of like my second home. And with the hospital redevelopments, I can immediately see the benefits that it can provide patients. There's going to be better sight lines to keep an eye on everyone, especially the critically ill. The physical construction of the rooms will lead to improved infection control, patient privacy, and throughput for our department staff. And with new equipment, we have the capacity to care for more people in our rapidly growing town. For the staff, the new space will probably reinvigorate the passion for healthcare, which has been rather trying during the past few years through the pandemic. And with the CT scan in close proximity, I feel that healthcare is really starting to get exciting in this town. It allows us to reach a diagnosis sooner, and this is really important in critical cases in the emerge, where we often need to arrange transfer to another hospital such as Walkerton for this test. And over the past few years, I've noticed there's a trend of increasing acuity and complexity with emerge presentations, and having a CT scanner locally will be a tremendous help for a lot of our patients. Having the scanner locally also reduces the strain, as Mike said, on our hospital staffing and transportation resources, since a lot of time we have to send nurses or even physicians, leaving our hospital a little bit short-staffed when we have to send patients out. And for the general population, having the scanner locally is not only more convenient, but it would obviate the need for travel during winter months where the roads aren't so good as we saw the past few days. On a personal level, I'm pretty enthusiastic about how all these changes will help us with recruitment. As most of you know, there's a shortage of healthcare providers in our area, and I'm hopeful that these changes will put us in a position to attract more family doctors, more emerge locums, and more nurses to work in our hospital. And thinking forward, hopefully building on that trend, eventually an expansion of our services in the future. Bottom line for me is that the hospital expansion, and in addition to having our own CT scanner, really puts our hospital on the map. And I'm looking forward to this as a pivot point in growing healthcare in Kincardine for years to come. I'm not sure who's after me, but thanks for your time.
Thanks very much, Dan. And actually, I told you the wrong number today, Dan. It was 1980 was when the emerge was constructed. So that's 43 years that building has been in place, and well due for an expansion at this stage. So what we're going to do now, so thanks again, Dan, for that. And thanks, Drew. We're going to go through, we have 3 of our managers to talk about specific areas of the expansion. The diagnostic imaging, the lab, and then the back of house with our manager of environmental services, Jen Van Manen. But we'll start with Trevor Filsinger, who's our manager of diagnostic imaging, and he's going to talk about what this expansion means to patient care from a medical imaging perspective.
All right, thanks, Mike. So hello, I'm Trevor Filsinger, the manager of diagnostic imaging and cardiorespiratory department. I'm responsible for the oversight of programs and specialized staff relating to medical imaging, such as CT, X-ray, non-invasive cardiac items such as ECG, Holters, and stress, as well as respiratory procedures, yet you might know of as spirometry and PFT. So we are excited to share that medical imaging, also referred to as diagnostic imaging, will be expanded to include over 7,000 square feet of new space. And it's important to note that the design of the CT and the expansion of medical imaging were done in a way that complements each other. So on the just one back if possible. So on the green shaded area, you'll notice that this is the new medical imaging, and in the top left corner is the CT, which is soon to be live. And so the department will have 2 main corridors, and from the left is the pink, the emergency department. So this corridor will be a focus of emergency and inpatients who will use this passage to access medical exams. And the more common emergency modalities such as CT and X-ray are located right beside the ED. And then in the top blue area, this is where patients will come in. This is a focus corridor for the outpatients. So after registering, patients will have direct access to the medical imaging department. And when you enter the space, you'll notice central wait space is located right there. Perfect. So the new design has many improvements. And a few of these are the flow for outpatients, emergency, and inpatients has been designed to minimize travel for both staff and for patients, while also improving privacy. To support a collaborative nature of the team, the design groups similar modalities such as sonography together, BMD, mammography, and then CT and X-ray. And what this does is allows our staff to provide improved care to the patients. Medical imaging has a common dedicated wait space that you enter as soon as you come into the department, but it also has separate change and wait areas closer to the exam rooms. So what this means is patients won't have to get changed into those gowns and travel long distances across the department. And then room designs are large enough to accommodate equipment, staff workstation, and then specific modalities such as ultrasound have direct access to washrooms. So both the design, the access features ensure we can continue to provide excellent care. And this expansion of medical imaging will ensure high quality, patient-centered care can be delivered now, but also into the far future. Back to you, Mike.
Thanks, Trevor. We're going to go to Kelsey Shembry next to talk about lab. And just to give you some perspective on this expansion, there's been a number of attempts in the past, probably 15 years, to expand the Kincardine Hospital, and they haven't got even close to the point that we're at now. So they were still at stage 1 of the 5-stage process through the ministry capital approval process. We are now at stage 3.1. And so we are well along this path. And all the designs you see here were based on input that we received from stakeholder groups, including our staff, our physicians, to make sure that these facilities are designed appropriately. So we're going to hear next from Kelsey Shembry, who's our manager of lab.
Thanks, Mike. Hello, everyone. I'm Kelsey Shembry, and I'm the manager of the laboratory department. So at South Bruce Gray, we have the core lab that collects specimens and performs analysis on patient samples, on patients seen through our emergency department, the operating room, as well as the inpatient unit and clinics. Additionally, we process urgent specimens collected through our outpatient department. So I also oversee the operation of the outpatient lab, which through an appointment-based system provides specimen collection for patients throughout our 4 communities. So with the Kincardine Hospital expansion, the core lab will be moving from its existing location and will now be connected to the current outpatient lab. So with this strategic design, we will be streamlining the flow of patients that come through our department. This includes a washroom attached to our waiting room, fully segregated phlebotomy rooms to enhance patient privacy, and a continuation of our appointment-based system to ensure continuous flow of our patients. The connection of the outpatient lab to the core lab streamlines the delivery of urgent outpatient samples for timely processing and personnel support between the 2 departments when needed. The movement of the core lab to a more central space better positions us to serve the departments within the hospital, and the carefully curated interior design improves workflow, improves staff morale, enhances our ability to work interdepartmentally in emergent situations, and gives South Bruce Gray Kincardine site a competitive edge in recruitment. The new workspace also ensures we are compliant with mandatory lab accreditation standards and infection prevention and control requirements, ultimately elevating the quality of care we provide. So having a larger lab space also ensures that we have the ability to bring on board analyzers that can support our increasing workload and our growing community now and into the future. So on the slide here, we have our strategic layout to ensure blood and blood products are easily accessible by lab and nursing staff in urgent situations. Our outpatient specimen collection is located at the main entrance, as I had mentioned, with a washroom off of the waiting room and fully private segregated phlebotomy rooms to maximize patient privacy. Specimen processing is to be located between specimen collection and the core lab to improve our workflow. And the core lab and the outpatient collection centers share a specimen processing zone to facilitate timely transfer of urgent same-day specimens and to allow for interdepartmental support. Thank you.
Thanks, Kelsey. And tell the audience what phlebotomy is.
So phlebotomy is when we stick a needle into your arm and take some blood. So it's a well-used service in the community, and certainly at our Kincardine site, it is the busiest outpatient lab.
Thanks, Kelsey. yeah, so again, we're really making significant improvements on all aspects of the hospital, including diagnostic imaging, as Trevor described and Kelsey described with lab. But we're also making significant improvements on the front of house and back of house. And Jen Van Manen, our housekeeping manager, is going to give you an overview of our back of house pieces. And I'll just give a shout out to Jen. When you come into our facilities, you'll see how clean, well cared for they are. And that's a big thanks to Jen and her housekeeping team. Jen.
Hi, my name's Jen Van Manen. I'm the Environmental Services Manager at South Bruce Gray Health Center. Environmental services encompasses nutrition and food services, housekeeping and linen services at all 4 sites. For the back of the house, the redevelopment brings some exciting and welcome changes for us. There's a lot better layout to the facility for patients, staff, as well as visitors. The receiving area is going to be expanded to improve workload, as well as it will be covered from the elements for the staff that have to go to that area. It's also going to include a separate clean and soiled waste area to meet IPAC standards. There will be improved access to the waste and recycle bins to address current safety concerns with the current receiving area. We will also have an improved workflow and space for our biomedical waste storage. For plant services, they will all be located in the lower level, and the updated infrastructure will be more energy efficient. For food services, there will be one directional flow from receiving to storage. We will also see increased capacity in our walk-in fridge and freezer space, which is currently undersized. So we are really excited for the changes for back of the house. It means a lot of the things that you see in the hallway will no longer be in the hallway, and our hallways will be clear. So it's exciting for our team for sure. Thanks, Mike.
Thanks, Janet. And maybe, can you just let the audience know the size of the kitchen is actually reducing in size by a very small amount? So just give people confirmation that that's an okay thing.
Yeah, it's very okay. It's only I think about 100. It's very minimal, the square footage that is decreasing. But one thing that's most important is that the fridge and freezer space is increasing. Since we don't do any food production in nutrition and food services anymore, we don't need the huge amount of space that we had in the past. So the reduction is quite fine, and the workflow will be good.
Great, thanks, Jen. So just to summarize, the expansion is a long overdue. As I said, this area of the hospital was constructed in 1980, so coming up to 43 years ago. Well overdue for an overhaul. We're going to see a significant expansion in square footage on all these program areas that you've heard about tonight, and will serve, as Dr. Sung said, an ever-growing community. So this is a fantastic thing. We are moving forward with this expansion. As I said, it's well overdue. And we've got some other good news that MPP Lisa Thompson is going to share with us tonight. So I just want to make sure Lisa's on. Are you there, Lisa?
I am.
Welcome.
Thank you. Thank you very much. Well, good evening, everyone. And it really is an honor and a very proud, I'll say proud moment to join Mike and everyone on his team as they share the excellent progress that has been made in the redevelopment of the Kincardine Hospital. It's been a long time coming for the community, as Mike has alluded to. And, we've heard about the ever-growing community and the need to attract and retain new talent as well when it comes to healthcare. And this redevelopment is certainly going to do that. And it's going to give, hospitals are always a pillar of our community, and it's going to give the overall community a tremendous sense of pride as well. And so, Mike, to you and your entire team, Bill, to your board, and I see John Haggerty here. It makes me think of the foundation as well, but to everyone on the foundation, as well as the hospital board, and Mike and your team, congratulations on what you're sharing with the community this evening. It has been just a tremendous amount of work that is not lost on anyone. But since we're talking about expanding services, I really appreciate the opportunity this evening to join all of you, to share with you that we have some more good news coming for the Kincardine Hospital. Mike, I think it was over a year ago, or almost a year ago, that that you reached out to me sharing that, you know, it made sense not only to have a CT scanner in the Kincardine Hospital, but recognizing the progress and the advancement in the tools, diagnostic tools that have become the norm for many medical students and teams graduating. It was important to move the dial as well for small town rural hospitals. And so I readily supported Mike's application, I should say South Bruce Gray Hospital, or the health center's application for an MRI for the Kincardine site. And ladies and gentlemen, I'm really pleased to share with you this evening that the province is investing over $20 million in MRI imaging across the province. And that translates into a commitment to operational funds for an MRI right here in Bruce County, specifically the Kincardine site. So I see somebody clapping. That's great. I appreciate that very much. It's a nod to the doctors, the nurses, the community, and most importantly, the management group at South Bruce Health Center. I should say South Bruce Gray Health Center. And I also want to share with you, you know, out of those 27 MRIs that have been awarded and approved across the province, 3 of them are coming to Huron Bruce. And I'm really, really proud of the work that has been done to realize this achievement and this investment in the Kincardine site, as well as Wingham, as well as Goderich. And there's a need for it. Again, it's been, I'm sure if we talk to Dr. Sam or whomever walks the hallways in the Kincardine Hospital, they'll say MRIs are the tool that we need to move forward. And there's so many benefits, from the reduced radiation exposure for children through to the benefits and the timeliness of imaging for our medical teams. And most importantly, it's bringing healthcare closer to home, eliminating the need for those drives that we heard about in terms of accessing CT scanners. So Kincardine Hospital, when you see your hospital redeveloped, know that we're doing the collective we, from your board to your foundation, to Mike and his management team, through to the province, we're doing everything we can to ensure that you have the right tools to serve your community. Thank you for inviting me to join you to share this announcement this evening, Mike.
Oh, thanks very much, Lisa. This is fantastic news. And it was about a year ago, January this year, I guess, that we submitted the business case. And a really interesting thing with South Bruce Gray is we were the first hospital in Canada, a rural hospital in Canada, to get a CT. Now we're going to be one of the first rural hospitals to get an MRI. And so this is fantastic news. We have had challenges getting our patients to get an MRI appointment. The government recognized that and is making this investment so that our patients can get easier access, more timely access, and close access to home. And it's a big deal to have an MRI in a rural community. So we're very, very pleased, Lisa, and appreciate all your support. We've had nothing but support from Lisa throughout all these capital projects that we were describing tonight.
Well, I just want to give a shout out to you, Mike, and your team. Ladies and gentlemen, you have to know that the business case that was put forward for this MRI in the Kincardine site was second to none and very compelling. And it was a shining example of why we need to bring modernization with regards to diagnostic imaging to rural Ontario, specifically in this case, Kincardine. Congratulations to you all.
Thanks, Lisa. This is fantastic news. And if you look at the map that's on the screen right now, the stars are where MRIs exist today. And you can see there's a huge gap there where we need service. And so now we're going to have that service. And thanks to this announcement today, we're very fortunate. And again, a big thank you to the government of Ontario for placing their faith in we are a small rural hospital in placing their faith in us to put a MRI into our facility. And the timing really couldn't be better. As we expand the hospital, the CT is there, it'll be operational in March, and now we can move forward with the MRI.
Very good. And Mike, I'd be remiss if I didn't note that we also are very pleased to ensure that, you know, the funding is going into hospitals where you deserve it. And with regards to infrastructure renewal funds, I'm just checking my notes here, and the South Bruce Gray Health Center is receiving over and above the operational funding commitment for the MRI in terms of infrastructure renewal funds for the next through to March 31st, I believe it is. You'll collectively, through the 4 sites, South Bruce Gray Health Center is receiving $692,042. So again, compelling cases that lead to upgrades, maintenance, and repairs that, again, will go a long way. So it's good news all the way around today in Huron, Bruce.
Thanks, Lisa. And that is a really good point to recognize, is that the government gives us funding for infrastructure renewal. And the infrastructure renewal is, I always say, is not the sexy stuff. It's the nuts and bolts of our facilities, sprinklers, asbestos removal, things that we need to do that we need to find funding for because it's expensive work. And the government has shown its commitment to us again, and over almost $700,000 of infrastructure funding this year. So that's a fantastic plus for us at the hospital to be able to do that important work.
And Mike, if I may, just to close off, I just want to share an astute comment that was shared earlier today when I was in Clinton. You know, when the province can help local hospitals with capital improvements that ultimately offset operational expenses, it's a wise investment. And that's exactly what the infrastructure renewal funds do. So, you know, when you couple that with the MRI news today, it's just a perfect complement to everything you're achieving with regards to the redevelopment of the Kincardine Hospital. Back to you.
Thanks again, Lisa. And on behalf of our board, our staff, our physicians, and all the patients we serve in the communities of Kincardine, Chesley, Walkerton, and Durham, a big thank you. This is incredible news that we received tonight. Okay, so we've got some more great news from our foundation partners. And we've got Jack Nanscoville, who's the vice president of the foundation, and Becky Fair, who's the president of the foundation, here to talk to us about the foundation, what it does, and the important work that they're doing to make sure that we have our local share of funding to support these projects that we've described tonight.
Thanks, Mike. And I have to apologize. My camera doesn't seem to be working. So you get to hear me. You just don't get to see me. But I do want to comment on that fabulous news that Lisa just shared with us. It's certainly going to change things for the foundation, but we're up to the challenge, and we're quite excited. So that is great news. Just wanted to kind of speak to the foundation and what we've been doing. We essentially have struck a capital campaign committee that is working specifically on the redevelopment and fundraising for it. Again, our slogan is building healthcare for generations, and that's what we intend to do. We've been working closely with the hospital since the start of the CT and the expansion project. We have 2 foundation board members that sit on the KROC committee. And we are also, we've committed $3 million to the cost of the CT scanner, and our funding target for the redevelopment will be changing based on this news. We could go to the next slide. actually, we can go on to the next one too. So oftentimes we get asked, what is the foundation and what is the hospital? And we thought this was a really important slide to share with the folks on the call today, and that the foundation and the hospital are completely independent of one another. We are separate corporations with separate board of directors. We also have very different roles. The hospital's mandate is to operate and manage the 4 hospitals, while the focus of the foundation is to fundraise for the Kincardine Hospital. However, that being said, we work very cooperatively because we have a common cause, and that's the best interest of the hospital. So why do we have to fundraise? Well, unfortunately, the province does not provide any funding for the purchase of medical equipment. The province provides the hospital with operating funds, but they do not always cover all of the programs and services that the hospital wishes to run. The province provides funding for the major capital projects, but unfortunately, the hospital still needs to raise the local share. And Jack's going to speak to that in the next few slides. Jack, are you on the call still?
I'm just unmuting myself. Thank you.
Excellent. Thank you.
We did have another slide in there, but we've omitted that one. But just for the purpose of the community to bring them up to speed on how this process happens with respect to South Bruce Grey needing equipment and the foundation funding that equipment. In the spring of each year, we receive a capital list from South Bruce Grey for the required equipment to ensure that the Kincardine Hospital retains its vitality of healthcare. And so we address that list, and along with it, we share with the auxiliary. The auxiliary actually selects a few of those items, and we as the foundation stand tall for the rest of them and fund the rest of the equipment requested. As you can see from this slide, in the 10 years from 2011 to 2021, we actually purchased $3.7 million worth of the equipment that you see on the screen. And oftentimes the equipment is no longer seems to be in place, then we have to replace it because technology is advancing at a very quick pace. And you also notice that the auxiliaries also purchased $300,000 worth of equipment during that same period. So it's a total of $4 million over that 10-year period. Next slide, please. You'll notice that for this year, 2022 to 2023, and by the way, our year end for the foundation is March 31st. But you'll notice our total commitment for this year is $2.558 million. And that includes the cost of the CT scanner, the final payment, which will be made over the next 4 months as the CT comes online, as you saw earlier on March 20th. We should also acknowledge that we've been very, very grateful. Bruce Power provided $1 million towards the purchase of that CT scanner. And by the way, the provincial government also provided $2.7 million for the building. So that has been a huge, huge cost benefit and benefit to Kincardine. Initially, we started out with a cost of about 4.3 million. And after we get through now, we're closer to about 5.8 million. So you can see the escalation of costs over the period that we have been building the CT and providing that service to Kincardine. Next slide, please. The redevelopment is a total cost of over $65 million. And just so everybody understands, when it comes to the actual building, the provincial government will provide 90% of the cost of that building. But we, as a community, under what we term as the local share, must provide 10% of the cost of that building. We also provide 100% of all other retail space like parking, the foundation office, the auxiliary gift shop, and other non-medical programs. So any chairs, any computer equipment, anything else that has to be provided, it is at our cost, the local share, which is funded therefore by the foundation. We also provide 100% of any commissioning. So during the rebuilding and the redevelopment process, we will see equipment relocated and put back into place later on in a new spot. We are responsible for that costing. So the local share for the redevelopment is 10.139 million. And you also notice down below that the Ministry of Health, through our provincial government, is providing over 55 million towards that same project. So that's a huge outlay, and it's a huge project for us to be participating with. Next slide. This comes to a summarization of our campaign goal and why we're seeking for $12 million. We will until the wonderful news that we just received about the MRI. But anyway, the current commitment, as you see, is 2.558 million. We're anticipating that the mammography unit, for a cost of a little over $1 million, will have to be done next year. We're also looking at the fact that every year for small pieces of equipment, the costing is somewhere between $325,000 to $350,000. And so we're providing that over the next 3 years, we will have $1,050,000 required to provide ongoing equipment for our hospital. And that brings us to a total of 4.61 million. Then you can see the local share for the redevelopment and expansion of the hospital is 10,139,000. We also feel it's prudent that we take into consideration any cost escalations and contingencies. As we recently experienced with, for example, with the CT building itself, the cost suddenly went in a year's time from 1.682 million to 2.55 million. So you can see the costs are escalating, and also there will be unforeseens. A building of this size will encounter certain unexpected events and surprises. We also feel it's prudent for us to retain a $3 million reserve fund. Just to give you an example, our X-ray machine was installed about 5 years ago, and we know that within the next 5 years, it will have to be replaced because of the advancements in technology. And that's probably in the area of $1 million touch. So we feel it prudent to have that $3 million in there. And I might remind the community, we can't go at these campaigns twice. If we have something unexpected, we can't come back to you. We've got to do this right the first time. And so as a consequence, we have a total to be raised at $22,250,000. Now, we have been fortunate to the generosity of our community over the past 10 years, particularly. We have had a good number of bequests and gifts that have totaled a significant amount. And as a consequence, we have an investment fund of about 10.4 million. I might share with you that we did have it up to 11.5 million, but over the past year, paying some portions of the CT scanner and other expenses, we spent about $1.5 million of that. So the net amount to be raised up until tonight was 11,806,000. And so our campaign goal was at 12 million. And now the cost of the MRI will be something added on top of that. I might also share with you that we have elected as a foundation to do this capital campaign from within the community, with what we regard as community leaders and everyone within the community participating in this campaign. Because if we used outside fundraising professionals, up to 45% of the funds raised would walk from this community. So we feel it's very, very important that we do this campaign within, and we feel confident that our community will rise to the challenge. After all, this is a fantastic investment in our healthcare for generations. And if you can imagine from a personal standpoint, that even if you're transferred from our hospital to another center, now they will have CT images, MRI images to quickly understand your situation and quickly make resolution to resolve your problems. So I think this is a fantastic investment to ensure the longevity and, as we said, healthcare for generations. Thank you, Mike.
Thanks very much, Becky and Jack. And thanks really doesn't do the job with the foundation. All of these folks are volunteers. So this is not a job they're getting paid for. This is a job they're volunteering to give back to their community. Becky is the president, Jack is the vice president, all their membership, which includes Graham Hood and Carol Collins. They've invested numerous hours, days in advancing these projects, both the CT scanner, the capital expansion. So we're very fortunate to have these folks. You'll see them on the main drag during the car rallies on the Friday nights, selling the 50-50 tickets and many other areas where they're raising funding. And Jack and Becky also mentioned the auxiliary, a very strong auxiliary in Kincardine. As Jack said, they raised over $300,000. Just incredible folks volunteering for their hospital, which is beneficial to all of us around the table tonight. One thing I didn't do leading up to this, we have a committee of our board, which is responsible for oversight of all of these capital projects. It's called the Kincardine Redevelopment Oversight Committee, call it KROC. It's been mentioned a couple times by different presenters. And just want to recognize this group. So it has members of our board, Dr. Roth as well, who's our chief of staff, also a Kincardine physician, members of the Kincardine and Community Healthcare Foundation, Dr. Sung, as well as the site chief for the Kincardine community. And we also have 2 community members. So we put a notice out looking for community members who wanted to volunteer in this group to make sure that we've got full transparency and community involvement. And a big thank you to Blair and Maria, who are community members that have volunteered again to be part of KROC. So people are pulling together from all corners here to make sure that these projects are advanced and are successful. So we're very fortunate to have the strong support across the Kincardine community. So with that, you've heard about the CT scanner, you've heard about the expansion of the hospital, you've heard the great news from MPP Lisa Thompson about our approval for an MRI and the fundraising that goes along with all this. And as I explained to folks when they talk about the local share, it's ensuring that local communities have skin in the game. The provincial government has been very, very generous with all of these projects. But they also want to ensure that the local community is there side by side with the provincial government. And that's the money that Jack and Becky spoke to. So with those presentations, hopefully that gave you a good overview of the projects. We want to open it up to any questions that you may have in the community. We've got 16 people on Facebook Live, 59 on our Zoom call here. So got a good contingent of folks out, and first hand I see up is Mayor Craig. So I'll go to you, Kenneth.
Thanks very much, Michael. I am delighted and excited to hear of the support that the provincial government is extending to South Bruce Grey Health Centre, and particularly the Kincardine site. And I so appreciate the work that all the members of all the committees have done. This is our definition of local health is expanding quickly, and you know, I think that this is a great boon to our whole community. Now, one of the previous hats that I wore prior to becoming mayor was that of the spiritual care provider at the Kincardine site, and one of the most common conversations that I would ever have with any patients was, oh, I just got back from Walkerton. I just had a scan. That was the worst trip of my life. I can't believe that I had to do that. It was terrible. So the addition of a CT scanner and now an MRI in Kincardine, our next spiritual care provider will have to smooth over those conversations. We're so excited for this to be happening. Thanks very much for your work.
Thanks, Kenneth. And I'll just confirm that it wasn't the actual treatment in Walkerton that was the issue. It was the trip to Walkerton that was the issue. Yeah. So thanks, Kenneth, and really appreciate your support, and also appreciate the support of Hearing Kinloss. I see Don Murray is on the call tonight, and I know Don has a council meeting tonight as well, and he was is taking a break from his council meeting to be here for the announcement with MPP Lisa Thompson. So thank you, Don. And then Mark Getz, who's the new mayor of South Bruce. Very happy to have him as part of this conversation as well. So I'll open it up to questions. If you got questions or comments, you'd like to hear about any of these projects, we'd be happy to answer them.
And I guess, Mike, the way to do it is via the Zoom chat. You can type in through the chat. With Zoom, you can raise your hand, and on Facebook Live, you can go to the comment section.
Great. So thanks, Bill. And so first question is from Liz Dadson. And what is the estimated cost of the MRI and estimated time it will be up and running? So this is news hot off the press. So we have some preliminary estimates of costs. So a new MRI machine is typically in the range of $2.5 to $3 million. And then we also have to modify the construction footprint to accommodate the building. So we'll be coming back with more details around what the cost will be. Our timing, we hope to have it align with the hospital expansion because the room or the space where the MRI is going to go is going to be part of that expansion. So we'll be back with more details. As I said, we're happy to hear the news tonight from MPP Lisa Thompson, and we'll be back with the community to provide a bit more details in the very near future. And then a couple of comments from the Facebook page. Great news, congratulations. And then question, Jack, how much of those funds as a percentage comes from individuals, not municipalities or corporations?
Well, we're expecting about 50% from individuals and businesses in the community. The other 50% we're hoping to raise from the major stakeholders. And I'm sure the two mayors that are on tonight will understand when I mentioned that they are two major stakeholders along with Bruce Power. But that is our aspiration at the moment, is that about $6 million of the 12 million would be raised from the community at large.
Thanks, Jack. Other comments or questions? Again, as people are pulling together their questions, we've got, we'll be recording this session. So the session is being recorded right now. We'll be posting this on our Facebook page so people will have the opportunity to see this presentation in its entirety at a future date. Liz Dadson again, to clarify, the MRAP application went in this past spring. Liz, the business case was submitted last January. So it was January 21st is when we submitted the business case.
If I may, we will be sending out a news release anytime, Liz, that will give you more details as well. And by all means, contact my office if you have any further questions after.
Thanks, Lisa. And Liz already got one, but they buried the lead. Not sure what that means, Liz.
It was a combined, so Liz, and to everyone attending this meeting virtually, the news release went out talking about the significant investment in healthcare across the riding of Huron Bruce. And the initial part of the news release was with regards to the infrastructure renewal funds. Over $7.7 million it has been awarded for, as I mentioned before, repairs, maintenance, upgrades, etc., in the hospitals in Huron Bruce. And then, of course, the MRI machine, being awarded to Kincardine, Wingham, and Goderich was in that release as well. But we can follow up tomorrow.
Thanks, Lisa. And the hospital will have an announcement to follow on. Lisa's just a bit more detail about the MRI, what it does, the difference between it and the CT. So that's going to be coming out shortly. And maybe, so Liz, you're asking lots of questions here, so I'll try to answer them. What prompted the application? For us, you saw that map where there was no MRI in close proximity to this neck of the woods. This portion of the province was, you had to go south to Stratford or London or Kitchener, north to Grey Bruce, Owen Sound. And we had challenges accessing MRI appointments in a timely fashion. And if you spoke to our our physicians that would be referring patients there, they would express the challenges that they were facing. So we knew that we needed to have something closer to home. And it was a big step for the government to make the decision to allow MRIs to come into rural communities, and which they've done. And again, it just shows confidence in small rural hospitals and the need to make sure that that service is close to the patients that it's going to be serving. So we're very fortunate. This is going to do a wonderful job of helping to get better access for those folks coming to our area, or sorry, living in our area. The other thing that's really important is that with MRIs and CTs, the images that are created are read by a physician. They're called a radiologist, and that radiologist, we have 3 great ones here at South Bruce Gray Health Center. One lives just south of Kincardine. But to attract new radiologists, they are very interested in making sure they have all the modalities, they're called, all the different types of imaging. So mammography, X-ray, CT, and MRIs. And so new physicians, new radiologists coming out of training want to have that MRI as one of the modalities that's available. So it makes it much easier for us to attract those radiologists, which is always challenging in rural communities. Liz.
Yes, I just can't type fast enough. Okay. This is all real big news. Like, it was worth tuning in for this about the MRI. But what I'm trying to ask is, with everything that's going on, the CT scanner, the redevelopment, et cetera, at Kincardine, why would you add yet another project? So that's what I meant by what prompted the going for that other bit.
Lisa, did you want to jump in, or do you want me to?
Well, again, Liz, I'm actually looking at Dr. Song right now because Liz, again, as I mentioned earlier, we need to make sure, in order to attract and retain the best talent that we can for the Kincardine and district, the area from Ripley towards, Highway 4 through north towards Saugeen Shores and beyond. We need to make sure that the talent that gets attracted has confidence in the tools that they have at their fingertips. And further to that, Mike talked about the exorbitant wait times for MRIs, and this is going to bring that service to the doctors so that they can serve the people in need in a timely fashion right here in our own backyard. And I'm wondering if Dr. Song would like to expand on that.
Yeah, I would agree with your and Mike's comments. A lot of what I said about the CT applies to the MRI as well. CT is usually what we use in the acute care setting and the emerge. There are less cases in the emergency department that we use the MRI, but we still would use it. But it's all about creating capacity and building healthcare. Right now, we have predominantly a family medicine run healthcare system in Kincardine. If you want to attract more specialists, having these modalities would be very helpful. And also, a lot of my patients, they're waiting often extremely long for simple MRI tests that just having another one locally is not only better for our town, but just wait times and might even attract some tourists as well, medical and personal.
Thank you for that. And I might say the timing is absolutely perfect in terms of the redevelopment phases. It's not going to be an add-on. The MRI suite, if you will be embedded into the redevelopment plans. And that's just astute planning as well. So as I mentioned before, Liz, I congratulate the entire team involved here in making this happen. And I have every confidence in Becky and Jack and the community and the neighboring municipalities in their support in making this happen as well.
Okay. Well, what I'd like to know is, if you were putting this application in January of 2021, why are we just hearing about it now?
Oh, no, to be clear, it was January 2022.
Okay,
so it's almost a year.
Just this past January is when you submitted
Correct.
the application?
That's,
Okay, I wrote down 21, so.
Yeah.
But even still, I mean, that's huge. I mean, really, really, really huge to just be hearing about it now when you applied for it almost a year ago.
Liz, as you can appreciate, with regards to any approval process, there's a lot of due diligence, and it is what it is at this stage. I'm just pleased that out of 27 MRIs, 3 are coming to Huron Bruce. When I received the news, it was phenomenal over the last couple of days. I received, and the communities are receiving it as well in the spirit in which we realize we want our hospitals as modernized with regards to equipment as possible. And Dr. Song, actually, just one last question for me. Would you not say that the norm has become MRIs? MRIs are used in urban centers maybe more than X-rays in the spirit of modernization?
It depends on the situation and what you're looking for. I would say CT definitely has become standard of care. MRI is a luxury that I'm glad we're getting. But nevertheless, for a lot of musculoskeletal indications, MRI is useful. Sometimes there are a few things that don't show up on CT, then you need to further work up with MRI. But I would say eventually it will become more standard of care, and I think we're just ahead of the game.
I appreciate that clarification. Thank you.
Thanks, Dan. Kenneth?
This is more anecdotal than question or comment, and I appreciate Dr. Soon's comments. And when I was growing up, I had some really astute, experienced doctors, and many of you can likely put a name on who those experienced doctors were, and they would listen to you, and from their experience, they would say, well, I think we'll do this. And, you know, most times it worked, but sometimes it didn't. And then you go back and you say, well, we'll try this. We now have a new generation of doctors, particularly like I noticed them at the Kincardine site. And you come in and chat to them and say, we're going to send you for a test with a CT or something like that. It's just a different way to diagnose the issues. And with the CT scanner and now the MRI and Kincardine, you know, the techniques that they have learned coming out of med school that they expect to be able to use will be right here in Kincardine. They don't have to send us to Owen Sound or Toronto or someplace for a test. It's right here where I don't have to guess. I don't have to do anything. Let's do the test. Let's get on with the process, and we'll get you fixed up in a timely manner and get you out of the hospital and go back home and do whatever you want to do. But like that's the generational change in medical provision. I think it's a wonderful direction that we're heading. Thanks so much.
Thanks, Kenneth. And there's a great question about staffing, which is a really important part of this conversation. And I'll read it, and then I'll look to Trevor, who's our manager of diagnostic imaging, for the answer. So is South Bruce Grey hoping to hire new MRI trained staff in the future, or will there be opportunities for current South Bruce Grey Health Center MRTs to go complete the MRI certification, perhaps with financial assistance?
Yep, thanks, Mike. And obviously, as announced, there's 27 different MRIs being awarded across the province, and that's something in the back of my head is where we're going to find the staff to operate this equipment. So we do have options, and one of those is to send our current staff to be trained. There is an accelerated course that takes about a year, or we can look at market and put some postings out and see if we can attract anybody. So it's something that as a program we have to look at and determine what is best for us, but we do have options, which is nice.
Thanks, Trevor. And we've got some runway here. So the MRI is not being installed tomorrow. So will be part of our planning that will be ready to go when the MRI gets installed, that we'll have the staff here to properly train to staff and care for the patients coming in for the service. Okay, other comments or questions from the group? Liz Dyson's giving us a toot of the horn, so that's good. Maybe I'll just go back to the panel members. Anything else that people didn't get a chance to say or wanted to add into the conversation?
Mike, it's Becky from the foundation. I just wanted to reiterate that we're thrilled and we're so excited that this is coming to our community. And I think that we all have to remember that, you know, while the redevelopment consists of a lot of, you know, equipment, bricks and mortar, we need to remember what it is actually going to be doing for our staff, for the work environment there, for physicians. It's going to aid in physician recruitment. And most of all, it's going to bring improved patient care for all of us. I encourage everybody who's interested in learning more about our fundraising to visit our website at kincardinfoundation.ca. You can take a look at our case for support. We have a really strong dynamic group of committee members who are committed to this, and it's daunting, but I feel like we're up to the challenge, and I know we will get support from our community.
Thanks, Becky. And for any of you that attended the Rock with Your Docs party last spring, was a huge fundraiser for the community, and that's the type of fundraising that is just one example of what the foundation's doing to bring the group together, and the capital campaign committee is doing to raise funds for all these important projects. And Liz, it's probably my mistake when I said January 21st, because it was submitted on January 21st of 2022. So you probably did write down that 21st the right way. Okay, any other comments or questions? Okay, so I'm not seeing any further questions. If just before I pass it to Bill, if you have questions leading up to this, please feel free to get in contact with anyone here at the hospital. Happy to answer your questions, and want to make sure that the community is informed. If you got any questions or concerns, please reach out. So with that, I'm going to pass it back to our board chair, Bill Heckela.
Thanks, Mike. As we conclude our session this evening, I'd like to thank all of our panel members for leading us through this informative session. The advancement of these major capital projects, now including an MRI, will allow us to continue to enhance the delivery of high quality care at South Bruce Gray Health Center, and will help us to achieve our vision of together enriching healthcare in our communities. To our staff, physicians, and external contractors, thank you for your work and dedication in the preparation and advancement of the Kincardine capital projects. Lastly, to our partners and community members, your ongoing support is greatly appreciated. With that, I'll adjourn the meeting this evening. Take care, everyone.